Okay. Hi, Juan. So you are being discharged today, and so here I have your visit summary and discharge information. So just to go over your stay, basically, you came into the emergency room with palpitations, and we did an EKG and found out that you had AFib. And AFib is an irregular heart rhythm that is caused by the top chambers of your heart. I have a picture in here to show you kind of the layout of the heart. So your heart has 4 chambers, and it was the top 2 are the atria, and those are what cause the AFib. And basically those don't contract correctly and actually kind of quiver, and that is what causes the irregular rhythm. And I know when you came into the ED, you said you had multiple energy drinks that day. A high amount of caffeine or any caffeine does increase your heart rate and blood pressure, and this puts a lot of stress on your heart to work harder. And over time, this repeated stress can weaken the heart and cause this kind of irregular heart rhythm that you experienced. I also know you mentioned daily alcohol use and occasional cocaine use, and these 2 things also rapidly increase your heart rate and blood pressure, just like caffeine does. So in combination, all 3 of these things really put a lot of stress on your heart to work harder. And on that note, we really recommend alcohol and cocaine use cessation, and also making sure that you're managing the amount of caffeine you're intaking or just drinking or anything like that, just because we want to make sure that we don't cause this heart rhythm to happen again or worsen the hypertension that you already are diagnosed with. And so regarding your AFib now, we were able to give you IV diltiazem or cardizem to correct that abnormal rhythm, and that's what it's commonly used for. And on that note, you are going to be sent home with an oral form of this cardizem that you need to continue taking, because this medication is going to keep your heart from reverting back to that abnormal rhythm. With this medication, you need to avoid grapefruit, so this is cause a reaction with the medication. And you should also stand up slowly, because this medication does lower your blood pressure. So if you stand up too quickly, you might feel dizzy and could fall over, and we obviously don't want that. And the lisinopril you're taking for your hypertension, which is one of your home medications I know that you said you were taking, can also cause dizziness when standing up too quickly. And on that note, I know that you said that you're a roofer, and since you're up on those elevated surfaces, we want to make sure that you're moving safely and slowly, and make sure that you take your medication with a safe amount of time in between, so that you're not up there on the roof and don't potentially have an accident due to being dizzy from standing up too quickly. Also with the lisinopril that you're taking, again for your hypertension, it can cause a dry, unproductive, meaning no phlegm, no mucus producing type of cough. And this is a side effect of the medication that we do need to be made aware of if you're experiencing it. And the last medication you're being sent home with is an oral medication called Coumadin, which we also call warfarin. This is an anticoagulation medication, so it helps prevent and treat blood clots. And the reason you're being sent home with this is because with AFib, you're at a higher risk for blood clots, because that blood gets stagnant in the heart since it's not being pumped out effectively due to irregular contraction. So we give this as a precaution to prevent those clots from happening. And since this medication prevents clots, I want you to know that you are at a risk for bleeding. So if you experience any easy bruising, bleeding gums, nosebleeds, or dark stools, you do need to get a hold of the doctor. And I have attached in here a sheet that lists those symptoms, just because they are serious, and we do need to make sure that you're aware of them and that you know when to get a hold of us regarding an issue with it. And then also with the warfarin or Coumadin, you do have to have follow-up labs in 3 days. So we need to schedule that, and you also need to follow up with your cardiologist in 3 days or sooner from discharge today. I can help you with scheduling those appointments now, or I have attached the contact information in here on how to schedule both of those appointments if you would rather do it from home on your own. And then I do have some additional just educational information for you. Seeing as you have hypertension now and now have also had AFib, we recommend a heart-healthy diet. I have a sheet in here that briefly outlines kind of the foods you should enjoy eating and the foods you should kind of avoid. So salt is a really big thing we want patients to watch out for in this diet, because it does increase the work on your heart as well and increases your blood pressure. So some things that we would recommend avoiding are microwave dinners, or ready-made meals, as well as canned food items. And then I also want to make you aware, because some people don't think about this, that some seasoning blends are also very high in salt. So it may be beneficial to look for alternative salt-free forms. And then again, I know I mentioned about the cocaine, alcohol, and caffeine use. I have provided in here with some information about some local organizations that specialize in helping those who frequently drink or use any drugs. And by discontinuing the usage of these things, adhering to your heart healthy diet, and sticking to your medication regimen, we hope that we can keep the hypertension and the AFib in check for you. Okay? And then if you don't have any questions for me, I did notice that you requested to get your flu vaccine. And just a little bit about the flu vaccine. It protects against influenza A and influenza B. It is a yearly vaccine that's given in the upper arm. If you have any preference to what arm you'd like me to use, please let me know. Just because your arm may be sore for a day or two after receiving this vaccination, and you might notice some redness, swelling, or soreness just in that upper arm where we'll be giving it. And some patients do report feeling off after getting the vaccine or experiencing headaches and muscle aches. But these are usually very mild and go away after a day or so. But just be aware that if you do experience any symptoms such as trouble breathing, hives, or swelling of the face and throat, that is indicative of an allergic reaction. So just make sure that you call 911 because that can be very serious very quickly. And that's all I really have, but if you don't have any questions for me, I can give you your papers and then we can get started on your flu shot. Okay? Alright. So for the flu shot, it is an IM injection. So I would be giving it in the deltoid here. So I'd feel for the acromion process, and then I'd go 3 fingers down from that, and then make a V with my fingers and give it right in between the V's, so kind of like back here. Okay. Okay, so I did hand hygiene. Now I'm putting on my gloves. Okay. I'm going to clean the top of this. Okay. Okay. Again, making sure this is clean. And then I'm going to drop 1 milliliter. One milliliter. Okay. And then I have a 25 gauge needle. Okay. And now I'm going to prepare the skin. Okay, and then now that the skin is dry, I've marked my site 3 down from the acromion process in between the V. I'm going to remove the cap.
Ta-da!